Hi, everyone, and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and I'm joined today by neurosurgeons. Oh, got an echo. Hold on. My name is Sarah Ridenauer. Sorry about that. It happened to me last time, and I didn't learn my lesson. My name is Sarah Ridenauer, and I'm joined today by neurosurgeons Dr. Teresa Wojtasiewicz and Dr. Jugal Shah. Today, we're going to be talking about neck and back pain, what causes it, the wide variety of treatment options, and how those options can be customized to patients' needs. So if you've ever wanted to better understand your spine, then stick around, share this broadcast with your friends, give us a like to let us know you're watching, and please ask your questions for our doctors in the comments below. First of all, welcome, and thank you guys both for joining us. Before we begin our discussion, would you please tell our viewers a little bit about yourself and your specialty? Dr. Shah, I'll start with you.
My name is Dr. Jugal Shah. I'm a neurological spine surgeon at MedStar. My career really started when I did my undergrad at MIT, followed by medical school at the University of California, San Francisco, and then finally 7 years of neurosurgery residency training at NYU before joining MedStar. I treat conditions of both the brain and spine, both with surgical and non-surgical treatment options. And I have a special interest in minimally invasive spine surgery.
Great, thank you. Dr. Wojtasiewicz?
And I'm Teresa Wojtasiewicz. I'm one of the general neurosurgeons here at MedStar with a special focus in novel treatments for pain, epilepsy, spasticity, and movement disorders. As a general neurosurgeon, the most common reason a patient is seeing me is because of back pain. So I'm very interested in chatting with you guys a little bit more about spine pathology. I did my undergrad at Barnard and then trained at Columbia, New York City, then moved out to Penn State Hershey for my intern year. And then I've been in Maryland doing my residency and training at Hopkins. So I have a lot of connections in the Maryland area and a lot of my Maryland folks. And, it's always a privilege and a joy to take care of the patients in the community.
Awesome. Well, once again, thank you both for joining us. Let's get into the questions. So, first of all, way before a personalized treatment plan is needed, the patient first needs to realize that they are experiencing this neck or back pain. So what are telltale symptoms of neck and back pain that's maybe like more serious than just, popping an Advil and going on with your day?
Right. So for kind of splitting the two apart, for neck pain, it's really pain that persists longer than a few weeks. And especially pain that's accompanied by numbness or weakness ends up being more serious, especially of the arms and legs. But oftentimes pain that happens kind of all of a sudden and not related to activity. It's very common to have either neck or back pain if you've slept wrong or slept funny. And most of the times they're very benign causes. But if they really persist or they're accompanied by numbness or weakness, that's when it becomes a telltale sign that something more serious that may need to be evaluated needs to get checked out.
Thank you. And then where exactly can this pain be felt? Like, is it just, your neck or back, or is it kind of all over? Can you explain that a little bit?
Yeah, so, spine pain there's a lot of different kinds of spine pain. Sometimes the pain is just right there in the middle of the back and it feels like a dull, bony pain. And then sometimes the pain, can go into the extremities. So you want to be very mindful of pain that seems like it shoots down like a lightning bolt going into the arms, hands, fingers, or into the legs or feet. But the most common spine pain does end up localized just to the spine itself. But it's important to note that sometimes the pain can actually be quite a lot more severe peripherally, so in the hand or foot, than it is actually in the center and the back.
Right, okay. And then what are the common causes of spine pain? Is it, anything having to do with genetics, or what are the common causes of that?
The most common causes tend to be something we generally deem as arthritis of the spine. Okay. Another way of putting it, the spine is a series of bones and joints that have lubrication and cushioning. And things like degenerated discs or aging and wearing down in any of these regions can cause spine pain. Other causes of spine pain can include, accidents such as falls or car accidents, and which can result in injury either to bone or muscle strain. And then finally, just as Dr. Wojtasiewicz was mentioning, if the pain can sometimes be worse in the arms or the legs rather than the back, and we oftentimes see that when there's a herniated disc that's pressing on a nerve.
And who is typically affected by this pain? Is there a specific like age group or gender that tends to experience this more, or is it kind of just happen to anybody sort of thing?
So the most common patients who are presenting to us are patients in, the adult age range. I would say, 30 to 70, is the bulk of our patients, but we do definitely see patients younger and older. Younger patients, the majority of spine pathology is degenerative, like Dr. Shah had mentioned, where it's just the bones, ligaments, discs with wear and tear over time. Mm-hmm. Or rarely, there can be other more unusual causes like tumors, malformations of the blood vessels, or other unusual things. So it's important not to ignore your pain because sometimes it can be something more weird. But the majority of this is degenerative, so just age and wear and tear. By the time someone gets beyond their 70s, a lot of times your body has adapted to whatever degeneration is there. I see a lot of patients in my office who are older and got a scan for some reason and they look fantastic and are feeling great with minimal pain. So it really is about the individual patient. It is also important, because it's about the mechanical stress on the back. Things like being overweight or doing positions where you do a lot of heavy lifting will put stress on the back and put you at a higher risk of having.
Thank you for explaining that. And so my next two questions are kind of go with what I started off asking about, when should you see a doctor for this pain? So first of all, when people start to feel back pain, is there a certain waiting period you all would recommend for them to, kind of determine how serious the pain is, whether they need to come see a doctor? I'll start with that. And then going along with that, when should they see a doctor and how would they know that they should see a doctor?
Right. It partly depends on what the symptoms are individually. For most cases, if it is just back pain and there's no numbness or weakness of the arms or legs, then most by the numbers resolve in the first 4 to 6 weeks. However, if there's associated numbness or weakness or bowel or bladder incontinence, that's something that becomes a lot more urgent. And in that case, medical attention needs to be treated immediately. But usually if it's just back pain that's benign, kind of came on gradually and might be associated with, increased new activity or new exercise, the vast majority of it resolves within the first 4 to 6 weeks.
Okay. And then Dr. Wojtasiewicz, when should they go see the doctor?
Yeah. So, most of the time it's a dull non-pain, and 4 to 6 weeks is a good time frame to see if the symptoms get better on its own, because fortunately most of the time they do. But you want to pay real close attention to the intensity of the symptoms. If you have horrible pain that is affecting your ability to walk, use your hands, use your feet, you have to see someone right away. If you notice, especially the time frame of the symptoms, if it seems like things are really getting worse every day, that's a reason to reach out to see a doctor right away. It's always a very reasonable idea to reach out to your primary care provider, but if things just don't feel right, your body, it's always reasonable to go to an urgent care or emergency room, especially if you're having a lot of weakness, changes in function in the bowel or bladder, because those nerves are very sensitive in the spine. Or, if that pain is really at a point that you just can't bear it anymore. And there's a lot of different providers that, all take care of back pain: primary care, physical therapy, neurosurgery, orthopedics. So it is important to monitor those symptoms and then, see a provider when it gets to that point that it's been going on long enough or the symptoms are severe enough.
Right, exactly. Yeah. And you should always, I know people always tell you, listen to your body and your body best, that sort of thing. So if you're in bad pain, go see a doctor.
And one of the things to highlight, it can be tough, especially if the pain's bad, but not that bad, and annoying, but not unbearable to the point that you can't carry on your activities. It can be a little tough to figure out, okay, who do I see? I don't feel like I need surgery. Right. And to help our patients, some of the team here at MedStar have developed this health questionnaire for spine patients. So we're going to send the link in for you guys to look at that. It's a sense to assess, it goes through some of the risk factors that could put you at a risk of cervical or lumbar spine, thoracic spine degeneration. And then based on how you answer those symptoms will help connect you with someone so that you can get in to see someone promptly, whether it's a physical, and the questionnaire we've designed it so it can route you to the best person. If it looks like your symptoms are relatively more mild, and you may be routed to a physical therapist. If your symptoms are, depending on how you route the questionnaire, you may be routed straight to see someone like myself or Dr. Shah, like one of the surgeons.
Awesome. Yeah, that's perfect. We will be posting that in the comments, like she said. So my next question is, speaking about going and seeing a doctor, can you guys talk a little bit about the diagnosis process and what that's like?
Usually the evaluation for spine pain begins with a very careful understanding and a history of the symptoms, the things that make it better, that make it worse, and the time scale of the symptoms, in addition to subjective symptoms such as numbness or weakness. That's followed by a careful physical exam where the nerves and the muscles of the affected body parts, arms or legs, are carefully examined to see if there are any concerning signs or symptoms of nerve dysfunction. Typically, if there's no numbness or weakness, then management is typically conservative and oftentimes begins with physical therapy, and in the form of less invasive imaging such as X-rays to make sure that nothing major is structural. Then if those symptoms persist despite those, at that point, usually an MRI is performed to see if there's any structural cause and really see where a degenerated disc might be happening, or if there is evidence of stenosis or pressure on any of the nerves.
Great, thanks for explaining that. And we'll get back into the questions in a minute, but for now, if you're just now joining us, thank you for tuning in. Today, I'm joined by neurosurgeons, Dr. Teresa Wojtasiewicz and Dr. Jugal Shah, and we're going to be talking about neck and back pain, what causes it, the wide variety of treatment options, and how those options can be customized to patients' needs. So if you want to better understand your spine, stick around, share this broadcast with your friends, give us a like to let us know you're watching, and if you have any questions for our doctors, you can leave those in the comments below. Getting back into our questions. So do different medical specialties offer different treatments? And can you, describe that a little bit, and can you tell us about the spine program at MedStar Health?
So, spine disease, just like many other diseases, is really a team approach. And there's no one right answer for, it's about what's right or wrong for the individual patient. So there's a number of different providers that help take care of our spine patients. It really starts with your relationship with your primary care doctor. That helps you maintain your overall good general medical health, and your primary care doctor has a good sense of when things are not right and when they need to send you to see someone else.
Yeah.
Our physical therapists are also really excellent members of the team and help provide really sophisticated, tailored exercises to help you get better. And you may think, you're pretty active, you exercise, you move around. The physical therapists are really carefully trained and go through a ton of schooling, so they know exactly the right or wrong exercises, and they watch you do those exercises to make sure you're moving your body in a way that's going to get you the best recovery. We also have a really close relationship with our pain management doctors. Now, a lot of people get a little scared when they hear pain management and they think someone's going to throw medicine at them. Medicine is part of the process, and we really try to avoid narcotics. Sometimes they certainly are necessary, but the goal is for that to be only a temporary approach. Yeah. The pain management doctors actually offer a whole lot of sophisticated treatments that are more minimal interventions, like injections, other kinds of infusions, and other kinds of nerve procedures that are more minimally invasive treatments and can offer you a really great relief with a lower risk and easier recovery than surgery. We also really collaborate very closely with the orthopedic surgery team. We have some of our orthopedic surgeons who are also spine surgeons, but we, back pain and hip pain, knee pain, can overlap, and it can be tough to figure out. Is it my shoulder? Is it my neck? Is it my back? Is it my hip? And sometimes it's a little bit of everything. So we rely on those specialties definitely to make sure that we're treating you from stem to stern, and we're not missing something else that could be, a different problem that actually is the real problem and not your back.
Right.
And then, of course, the neurosurgeons and the orthopedic surgeons that I mentioned who do spine surgery, once you get to that point that nothing else is working, or if you're at that point that the symptoms are too severe for you to try anything else, then we offer a variety of different treatments and surgeries that can give you that relief and get you on that road to recovery.
Yeah. So with all those options, then how does a patient know which type of doctor to see first? I know you mentioned primary care doctor, going to them could be a good place to start. Would that be your top recommendation, or is there other ways that they can determine the best place to go first?
Yeah, generally, as Dr. Wojtasiewicz said, your primary care doctor who knows your overall health condition best and would be aware of some of the more concerning symptoms usually serves as the initial hub. Mm-hmm. That being said, we do have a spine health risk assessment tool, the link we saw before, which can categorize your specific symptoms in terms of any concerning symptoms. Should you go and see a spine surgeon like myself or Dr. Wojtasiewicz sooner, or would physical therapy or more conservative or low risk treatments first be the first step? But if there's any questions, you can always reach out to your doctor and they can guide you.
Right. Great. Thank you. And so we mentioned individualized treatment plans a couple of times. How do you develop those treatment plans? And what are some things you take into consideration while going over this and talking about it with the patients?
Yeah, so, it really is about treating the patient, not just treating the MRI or X-ray, but it is a review. So you look at the patient, you see what symptoms they're having, how long they've been having the symptoms, the severity of the symptoms, what body parts are affected. You look at the pictures and look at the MRIs or X-rays and see how those MRIs and symptoms match up. If they seem like they're very different, then sometimes more testing is needed to look at maybe if it's something other than the spine that could be causing the problems. And then, based on the severity of how much pressure there is on the spine or the nerves on the MRI, we then come up with a sense of how likely it is that someone might need surgery. You also, we really carefully assess someone's other medical issues, because it's not just your spine doesn't exist in a little bubble. It's all about all of the different issues that are affecting you medically that certainly affect your spine as well. And it's really a conversation about how that patient is doing, how their pain is. And we monitor very closely to see, when someone is doing physical therapy or pain management, to see how they're responding and how they're overall doing. And if they're not doing well and things are not working, then we don't let someone just sit there in pain. We move forward with the surgery. That said, if people can have amazing responses to the non-operative treatments that ultimately save them from needing to undergo a big surgery. So it is really about assessing the individual patient, what's going on with them, what's going on with their family, who will provide support for them through the illness. So it really is a customized approach. And we collaborate very closely with the other people who are seeing the patient, who will cue us in if something's not right. Like if the physical therapist assesses someone and says, man, this person is really not doing well, they need to see you right away. Mm-hmm. Or if the pain management doctor sees someone and, they may assess you and say, my gosh, it's your hip all along. It wasn't your back. So it really is a discussion.
Yeah, that's great. Thank you for explaining that. And so talking about treatment options, can we talk through first some of the more, the conservative treatment options, what they are, their benefits and limitations? I think we've touched on some of them already, but I think that's a good point to go back over.
Right. Some of the conservative treatment options, especially when the pain is not so severe or it's been relatively short-lived, are home remedies. And a lot of times, if it's especially muscle strain or muscle pain, hot and cold packs can help, stretching, yoga can help, or even over-the-counter medications such as ibuprofen and Tylenol. For something like these home remedies, the benefits are that they're pretty easy to access, very low to no side effects. But these wouldn't necessarily treat numbness or weakness symptoms, and they don't necessarily treat what the core reason behind the symptoms may be. The next thing we talked about in terms of conservative treatment is physical therapy. And as was mentioned earlier, involves individualized structured exercises and stretches. And the overall goal of that is to build up the support muscles to the spine and core strengthening. And the benefits this way is that it's non-invasive, it's low risk, you're strengthening your muscles, but it doesn't always work. And depending on the underlying cause, if it doesn't work after a couple of weeks, more aggressive treatment may be necessary. We also mentioned, different members of our team, such as pain management physicians, who may offer injections, which can be targeted, less invasive treatments towards a directed part of the spine that is thought to be the originator of the pain. And this ends up being, same day in and out procedure that is more aggressive than some of the more conservative treatments, but doesn't involve an open surgery and a longer recovery of surgery. But the cons of this approach are that it doesn't always treat the underlying cause, and these remedies can sometimes wear off. And then there are other adjunct therapies that can be found at a local drugstore or over the counter, such as a TENS unit or a nerve stimulator, which could stimulate the nerves around where the pain is happening to lower the perception and lower the overall pain symptoms that are being felt.
Thank you for going through that. Yeah, I definitely think it can be comforting to know that there's a lot of other treatment options that you can try before you have to get into the talking about surgery and all that. So with that being said, when might surgery be necessary? Is it kind of once you go through, the list of what you just described, Dr. Shah, and that doesn't seem to work, or how is that determined?
So, as we've stressed multiple times, it really is about the individual case. So once you when I first see someone in the office, most of the time, when I see someone and when someone hears, you need to see a spine surgeon, they think, oh man, I don't want spine surgery. So we definitely try to avoid spine surgery whenever it's possible. We always try the other less invasive approaches when it's right for the patient. It's important to assess how someone neurologically is doing to make sure their spine can tolerate that waiting time to do those other treatments. There are some red flag signs, like we've mentioned: significant weakness, changes in bowel or bladder function, changes in walking or coordination with the hands, that can cue us in that something isn't right and we need to take someone to the operating room to relieve the pressure on their spine sooner rather than later. Most patients ultimately are able to try other treatments before they undergo a spine surgery. What I like to advise my patients is that, you're the one living in your body. You know what symptoms you're experiencing on a day-to-day basis. Your body tells you when you're at that point that things aren't right. If someone is overall feeling pretty okay and their pain's in a tolerable place, they may not need surgery. If I see someone and they feel like they're better but not better enough, and they still feel really debilitated by their symptoms, then a surgery definitely makes sense for that patient.
Right. Thanks for going through that. And Dr. Shah, I know I've heard a lot about minimally invasive surgeries in general, but spine surgery a lot recently. So can you explain what exactly is considered minimally invasive?
Right. So traditionally, all spine surgery was done with typically larger incisions and cutting muscle in order to access the spine underneath. And the idea behind minimally invasive surgery is accessing the spine through smaller incisions or from different approaches rather than from the back, but rather through the front or the side, with the overall goal of minimizing tissue disruption. And the rationale behind that is that it would result in faster surgeries, less blood loss, and most importantly, quicker recovery time after surgery.
So that leads into my next question. What should patients expect in terms of recovery, and does it vary by treatment?
So there's really a variety of different surgeries that we do. And Dr. Shah highlighted that we like to provide the most minimally invasive, smallest incision, least amount of manipulation as possible. You can think of spine surgery in two categories. Either you're taking something off that's causing pressure, or you're fusing something that's moving and it shouldn't be moving. Those are basically the two categories. the way that we describe those medically are laminectomy, which is removal of the bony elements, or discectomy, which is a removal of the soft tissue between the bones, that disc in the cervical or lumbar spine. And then the fixation, as you may imagine, is fusion, which can mean rods or screws, plates, or metal that goes in the space where the disc once was. And it really depends on the individual procedure. Some of our spine surgeries where we go from the front, the recovery is remarkably fast. Patients go home that same day or that next day, and within a week, they're feeling like $1 million and ready to go back to work and feeling, annoyed that we're giving them little restrictions that we don't want them bending, lifting, twisting too much.
Yeah.
But there are other bigger procedures that we do. I like to tell patients that cervical spine surgery from the back does tend to be particularly uncomfortable in terms of the incisional pain. So that recovery is going to be a little longer. I typically tell patients something like 2 to 3 months. Everyone's different. Some of the lumbar procedures are, again, they really range. When you're just taking off a little piece of disc through a tiny minimally invasive incision like Dr. Shah does, then that recovery is extraordinarily fast. And that person feels like $1 million even that same day. And when they go home, they feel a little stiff, but they're almost ready to go back to everything that they're doing. Again, we give you restrictions to make sure we keep you safe.
Yeah.
There are also bigger lumbar fusions that, again, are a little bit of a longer recovery, a couple days in the hospital. And again, it can take 2 to 3 months to really start feeling like your usual self. I like to tell patients that the recovery after any fusion takes up to a year, really more as a sign of encouragement. By the time you've gotten to the point that you need surgery, you most likely have been dealing with pain and limitations for a while.
Right.
You want to be patient with your body and let it make that full recovery. By about 2 to 3 months after a big fusion, you'll be feeling pretty good.
Yeah.
But that full recovery takes a year. So as good as you feel at 2 to 3 months, you're going to be feeling even better at that full year. So you want to be patient with yourself, and especially for our more active younger patients who have or patients who have really high expectations and want to get up to an extremely high level of function, don't be discouraged that you're still feeling a little stiff and under the weather at 2 to 3 months. You're going to continue to feel better.
Yeah. That's great to hear. And like you said, it can be hard for people who have experienced this pain for so long. They just want it to be done, but you got to wait a little bit. But it sounds like the recovery times can be pretty quick. So speaking of recovery, what is the long-term outlook for surgical patients? Is there any lifestyle changes that they need to make? I know that you just mentioned, a couple months after surgery, they'll have certain limitations that you guys enforce, but is there any long-term lifestyle adjustments that they'll have to make?
Right. So yeah, just as Dr. Wojtasiewicz mentioned, in the beginning, no bending, lifting, twisting, and oftentimes our patients who are undergoing fusions will require the use of a back brace to support the spine while everything is healing. And the full recovery takes about a year. In terms of long-term lifestyle changes, it really depends on the type of surgery and the level of the spine in which the surgery is happening. There are certain surgeries, especially higher in the neck, if they require a fusion, may result in long-term, a little decreased mobility in terms of rotational movement in the long term, but those surgeries are only undertaken if necessary and if no other alternatives. In the back, oftentimes patients who come to our attention who might have herniated disc or obtained an injury during a certain activity or lifting something, they'll naturally make lifestyle changes ever since that injury. But the overall idea is to maximize return to lifestyle with as few limitations over the long term.
Great, thank you. My next question is, are there any exciting innovations, research, or technology on the horizon?
Absolutely. So, the kinds of treatments that we use for the majority of our spine patients have been around for a really long time. And what we've found over the last years is that we do more and more minimally invasive surgery. So a smaller and smaller incision with an ability to perform that surgery more quickly, safely, with a shorter downtime and a quicker recovery. There's a lot of other things that we're starting to use, including CT scans that we can take in the operating room, which we can then pair with a kind of GPS system that allows us to know exactly where in the anatomy we're doing that procedure. So we can map for patients who have very complex and very degenerative spines, we can get a real sense of exactly what those bones are looking like. That maps us and allows us to do these minimally invasive surgeries and really, really hone in. There's a variety of other things that are on the horizon for patients where we don't have good conventional treatments. Spine surgery is extremely successful for the right patient. But unfortunately, there's a lot of patients who have neck or back pain where we don't have a surgery to fix that. I find that's sometimes the most frustrating thing is when I don't have a surgery that's going to fix someone's long-term pain. And that's where I really think research plays in to find better alternative treatments with interventional pain management, spine surgery, other kinds of stimulation procedures that can really alter the way someone is perceiving pain. I think with everything that you may hear about, pain medications, I think that better treatments of pain are ultimately going to be where a lot of research is hopefully going to be directed. And of course, we're also continuing to investigate and look at long-term outcomes for our patients with the surgeries that we do to get a real better sense of exactly how we need to customize someone's treatment plan to maintain their long-term excellent success.
Right, that's great, thank you. And before we get into our last question, we do have a question from one of our viewers. It's from Jean. Thank you for your question. They're asking, when do you see an orthopedic doctor versus a neurologist or a neurosurgeon? Which I know that we mentioned earlier, but I think that's an important thing to talk about again.
Yeah, so, orthopedic surgeons and neurosurgeons have a very good sense of their, what the other specialty can do. If you're seeing a spine surgeon who's been in practice and is fully trained, like myself and Dr. Shah, we're both neurosurgeons, but the orthopedic spine surgeons that we work with are extremely well-versed and well-trained and have a very good sense of they're basically 95, I would say almost 95% of pathology in the spine, either a neurosurgeon or an orthopedic spine surgeon can take care of that, as long as they're an orthopedic spine surgeon, and as long as the neurosurgeon is someone who specializes in spine as well, which the majority of us do. Anytime you see a provider, we have a really good sense of what our limitations are. So if I see someone and when I assess them on exam, I feel like there's something going on with their hip or their shoulder, because I don't treat hip, I'm not a hip and shoulder surgeon, I'll send them to the right hip or shoulder surgeon. And because we have such close collaborations with our partners, when we're sending you to someone, we're sending you to someone that we trust is going to do a great job evaluating you and will know their limitations as well. Mm-hmm. We frequently get patients from our orthopedic, non-spine orthopedic colleagues who assess a patient and are worried about their spine, so they have us take a second look.
Yeah, great. Thank you for explaining that, and thank you for your question, Jean. So my last question for the two of you is how we like to wrap up all of our broadcasts. What would each of you want to make sure people take away from watching this broadcast, the main message? Dr. Shah, would you like to start?
Yeah, I think the main thing to understand is that back pain is both common and treatable. And treatment doesn't always require surgery. As we spoke earlier, there's lots and lots of different treatment options, and there's no reason to suffer from this in silence or without medical attention. And I would really say that especially if it persists for more than 4 weeks, or if it's accompanied by weakness or numbness, then that's something that's important to speak to your doctor, especially because certain causes of these symptoms have better outcomes if identified and treated early.
Right, great. That's perfect. Thank you. Dr. Wojtasiewicz?
Yeah, well, excellently phrased, Dr. Shah. No patient should have to struggle with this kind of pain for as long as most patients unfortunately do by the time they get to see us. What I'd really like to stress is something I kind of mentioned before, is that, you're the one living in your body. You want to listen to your body. You get a sense if something is wrong, and the sooner you get that checked out, the less likely and it's going to be that you're going to need a big surgery, and the easier and better and faster that recovery is going to be. And if you're seeing someone and you feel like you're not getting the answers, continue asking and continue mentioning, and don't just brush it to the side or figure it's going to go away, especially if after more than a few weeks, things are getting any better.
Right. Thank you. I think those are both perfect ways to wrap up our broadcast. So thank you again to our experts for joining us and answering our questions. And thank you to our viewers for tuning in as well. To schedule an appointment with one of our experts, please call 443-777-8807. And then, like we said, we will have that short risk assessment quiz for neck and back pain linked in the comments below. Thank you guys for tuning in today, and we'll see you next time.